These guidelines are based on the Australian Guidelines 2020 and align with the position statement in the Royal Australian and New Zealand College of Obstetrician and Gynecologists. And it also aligns with other guidelines around the world. I just want to emphasize that long-term research has concluded that physical activity is safe during pregnancy. Now, I appreciate it's unlikely in your client group, but in the general population, only 15 to 30% of pregnant women meet the physical activity guideline for exercise during pregnancy. Based on an Australian study, only 50% of women actually received any exercise guidance during pregnancy, and often the guidance they got did not align with current guidelines. And in fact, 15% were actually told to stop exercise. Barriers to exercise can include physical or emotional restrictions. Physical, including morning sickness, dizziness, or fatigue, mostly experienced in the first trimester. The mother can be concerned about harming the unborn child, and there can be a lack of knowledge, including by health professionals, about the risk and benefits of physical activity for both mum and the baby. This is a great summary of the guidance for physical activity for pregnant women, which the private PT will go into in more detail. I just want to highlight several factors. The first is the benefit of exercise for the mother, the unborn fetus, and the newborn, which I have no doubt that you'll be on board with. For the mother, exercise is obviously important to help manage weight gain, keeping it at an optimal level throughout the pregnancy. It decreases the risk of diabetes or high blood pressure in pregnancy, called preeclampsia, reduces the risk of varicose veins, and can help reduce leg cramps, swelling, and constipation. It can decrease the risk and severity of back pain, and cardiovascular fitness for strength and stamina helps the preparation for labour, maintains muscle tone and strength for carrying baby and equipment post-birth, and overall helps the mother's mood. For the baby, it decreases the risk of preterm birth, reduces newborn complication, decrease the length of labour and the incidence of interventions, and it has been reported to reduce the need for a C-section by 20%. The exercise guidance for pregnant women is to do 150 minutes of moderate activity spread over most days of the week of any kind of a movement. Dancing, gardening, walking, anything to achieve moderate intensity of exercise. And the talk test is always a good way for your clients to monitor this intensity. Pregnant clients need to be directed to listen to their body when exercising and to help them adjust their routine depending on their comfort and tolerance as it changes throughout the pregnancy. The guidance also includes to complete pelvic floor exercises daily. These are the medical contraindications to exercise where physical activity is not recommended during pregnancy and will be directed through their medical team. For pregnant clients, the warning signs to stop physical activity includes chest pain, persistent or excessive shortness of breath or dizziness that doesn't recover with any rest, severe headaches, any pelvic contractions or any fluid or bleeding from down below. From a pelvic floor perspective, the signs to modify exercise include any bowel or bladder leakage during the exercise, or if your client comments on any kind of unusual sensation or pressure at the pelvis during or after exercise, any persistent pain at the pelvis or the lower back, please refer to medical or pelvic floor physiotherapist. You can help screen for pelvic health disorders just by asking your clients if there's anything that they want you to be aware of, any body challenges that they're facing right now, and refer them to medical or a pelvic health physiotherapist. Next slide.